Hey there, Derek Thompson, Results Personal Trainer and Group Fitness. I'm going to show you today how to use myofascial release, also known as foam rolling, also known as trigger point therapy, to eliminate or at least manage pain in your knees through foam rolling your quadriceps, your thighs. Okay, a lot of knee pain comes from trigger points inside your quads. Okay, I've managed this myself for many years now. I've kept myself going for a lot of years through working on these, using a simple foam roller. It doesn't take anything fancy in order to do it. Okay, so I'll show you. There's three main areas that you need to be working on. You need to be working on the inside of the thigh, up here where that teardrop shaped muscle is here. Okay, the vastus medialis, you need to work in here and all the way up the sartorius muscle, which is a strap muscle that goes all the way up and across the thigh here. Okay, you also need to be doing the outer kind of edge of your thigh here, up from the knee up, and your hip flexor, which is at the top of the thigh here, and then also your IT band on the outside here. So really you're covering almost your entire thigh, and you're looking to seek out the most uncomfortable, the most tender areas. That's where the trigger points are. Those are the bits that are causing the problem. This is what's going to resolve them. Rolling, doing a bit of deep pressure, a bit of deep tissue work via the foam roller on these areas is going to eradicate the pain and give you better range of motion as well. So you're going to be able to squat deeper, etc., and get rid of the knee pain as well, most importantly. So there's for the three positions then. We're going to do the side plank position first to get your IT band and the trigger points at about halfway up the thigh here. So when you start here and you start at the bottom, it's not too bad, okay? But once you get up to about midway up the thigh, then it tends to get very sore. And when I first started doing this, I could have cried, and I was doing it with a little soft spiky ball, and it was absolute agony. So working my way up the thigh, working my way up the outside of the thigh, and it's starting to feel quite uncomfortable here. It's not really that bad now, but that's because I've done this a lot. Okay, and I'm changing the angle of my feet so that I can lean back a little bit more, and then turning them down the way a little bit more, making sure I'm getting into the most tender areas that I can find up the outside of the thigh. The pressure might be too much for you. It might be really uncomfortable. Okay, so what you would do is take some of the weight off of the roller and put more weight on the floor. Get both hands down here, get this foot over here, take some of the weight on that foot, and then you'll have lesser discomfort when you're foam rolling the outside of the thigh. And just move slowly. You could do static holds, just staying on the bits that are tender if it's too sore to actually roll along them. Okay, so we do 10 strokes on the most tender bits that you can find. So I've done my 10 on the IT band on the outside of my left leg. Now, the next area to do is up this outer edge, up the thigh here, and then I'm going to carry on all the way up onto the hip flexor pocket area as well from there. So from here, I'll go onto this way around to show you. So from here, I'm keeping my foot at about 45 degrees and then rolling up the thigh there, like so. So rolling up, again if you want less pressure, just put one foot onto the floor to take some of the weight off the roller. So rolling up the thigh, the first 6 or so inches up the thigh. And then now I'm going to go a bit higher up and work my way right up to the pocket area, the entire pocket area, the hip flexor area, on the same leg, and there's a bit of discomfort there, a bit sore, so I'm going to continue working on here, and turn the foot one way, turn my leg around a little bit more the other way, to make sure that I get into the most tender bits. Yeah, that's me done the hip flexor. Now the final bit is to get right up the inside of the thigh, covering the vastus medialis here and right up the inside here. So I'm going to put the roller at a very slight angle and get on top of it with the inside of my thigh on here, and then just roll up the first 6 inches or so. Okay. Again, changing the angle a bit, like so. and then working my way up. I'm going to go a bit higher up the thigh. And then a bit higher still, getting right at the inside of the thigh, right up here. And then down again, and that's it. I've covered all of the main areas on the upper thigh on my left leg, and then I'm going to do the same on the other leg. Okay, so if you do this regularly, like 3 to 6 times a day, it doesn't take long. Okay, just a couple of minutes each time, and it'll make a world of a difference in removing your trigger points, which will eliminate pain and stiffness from your knees. Okay, and you'll get better range of motion so that you can squat deeper as well and have better movement without stiffness and pain. So I hope that you found this video really helpful today. If you did, you can hit the like button. You can also hit the subscribe button if you'd like to see more of this type of video content and some other training and nutritional content as well. Thanks very much for watching today, and bye for now.